Welcome to Birthing at Home, a podcast. I'm Elsie, your host. I'm a home birth mum of 2 little boys, a doula in Melbourne supporting birth at home. I'm a mental health nurse and the co-creator of Home Birth Victoria. If you want to learn more about me, the podcast, or my work, check out www.birthingathome.apodcast. Before we begin, I would like to acknowledge the Wurundjeri people who are the traditional custodians of the land I'm recording on in Naarm, Melbourne, Australia. I would also like to acknowledge that Aboriginal and Torres Strait Islander peoples have been birthing at home on country for tens of thousands of years prior to the British invasion and acknowledge that sovereignty has never been ceded. This is episode 66 and it's shared by Tegan in Queensland. This episode, unfortunately, is a roller coaster and I'm so grateful to Tegan for sharing her story. It's really difficult to summarise this story into a quick intro, but how's this? After being accepted and excluded from the local publicly funded home birth program multiple times, in her pregnancy with her second baby, Tegan made the decision to birth at home, unassisted. We talk about so much more in this episode too, like GBS diagnoses, antibiotics, gut health, breastfeeding, cervical ectropion, and even more. I really hope you enjoyed this episode. Welcome, Tegan, to Birthing at Home, a podcast.
Thank you. Thanks for having me.
Thank you for joining me and being patient for the past too long trying to sort out this podcast stuff.
Yeah. I know.
And also early in the morning for you because you're in Queensland.
Yes. But that's okay because my baby has me up at 5 a.m, so it's not that early.
Excellent. I'm like halfway through your day then.
Yeah.
Do you want to start off by giving a bit of an overview about who you are, who's in your family, that kind of thing?
Yeah. So I'm Tegan. I'm based on the Sunshine Coast. I am a doula and I'm also a Pilates instructor. I have 2 little bubbers. I have Charlie, who is 2.5, so not really a bubber anymore, and then Remy, who's 6 months old.
Yeah, amazing. And so you had Charlie in hospital.
I did, yes.
And then you had Remy at home.
Yes, that's right.
Yeah, cool. I suppose what I usually start off with is like, how did you know or find out about home birth, especially Charlie being born in hospital? Like, is home birth something that you've always known about or you only learnt about later?
I would say that I learnt about it after having Charlie. I guess I knew that it was a thing. I sort of became fascinated with birth a few years before I had Charlie. I was very much interested in, the natural physiological approach to birth, but home birth wasn't in my realm. And then I think it was after Charlie I got even more obsessed with birth and then started to hear about home birth. And then, of course, once I went down the doula route training, I learnt about it even more. And then I got to, when I was training, one of my trainee births was a home birth, and that was pretty incredible experience. And then after that, it was like, no, that's what I want for myself. I want that home birth. So,
what a gift. What a gift.
Yeah.
Imagine if all midwives got to see home birth, because most midwives don't even get to see home birth.
Exactly. It was, it really was a gift. Yeah.
Yeah, brilliant. And so you did your doula training after you had Charlie?
Yes.
Yeah, cool. Do you want to walk us through like a bit of the journey with like pregnancy and the birth with Charlie then?
Yeah. So we were traveling Australia in a caravan at the time. We'd just not long gotten married and it seemed like the right time to start trying. I was pretty obsessed with birth already. As I mentioned, I think I started the normal route of watching One Born Every Minute, which now I would cringe at. But you start there and then you delve into listening to Australian birth stories. And so by the time we were actually trying to conceive, I was like down the rabbit hole, obsessed. And we were lucky to fall pregnant quite easily. And it was a pretty smooth pregnancy. I guess initially it was a bit tricky traveling and trying to see, get into the doctor to get things confirmed. We were seeing a different doctor everywhere I went.
Wow.
And I knew enough to know that I wanted to get into MGP and I knew you needed to be referred straight away. Yeah. And these rural doctors just didn't get it. The first doctor was like, oh, no, you don't get referred until 20 weeks. And I was like, right, okay, I'm not getting anywhere with you.
Yeah, wow.
And then we obviously kept traveling. And then the next doctor, I tried again, and they were like, oh, no, not until you're 12 weeks. And then finally this elderly doctor that I'd seen, he like hand wrote me a letter, which wasn't suffice, but I appreciated his effort. And in the end, I just gave up on it. And it wasn't until I got back to the sunny coast, I think I was about 13, 14 weeks. And my GP referred me, but I missed out. But
what the heck? Oh my goodness! Yeah. So you're traveling around, and like, did you, because your residential address was on the sunny coast, were you still sort of restricted as to where you could access that model of care if you had been successful? Or like when you're traveling, like, can you sort of like, what if you were on the other side of the country? Like, do you know how that would work?
I think because our plan was always to be home, like we were only traveling at that time. Yeah. I don't think it's a restriction based on who can refer you, because obviously our home residence is still the Sunshine Coast. Yeah. We have a house here. We were renting it out, so we knew that we had somewhere to go home to. Yeah. So I don't think it was a concern. I think it was just that the places that I were, maybe they didn't have MGP there, and they just didn't really get what I was asking for. Yeah. So that was really tricky, and I just kind of gave up on pushing on it, and I thought, if it's meant to be, I'll get him once I get home. And we were home earlier than planned, but I was still too late. Wow. Which is a shame, but that's okay. I had actually looked into a student doula for myself and had one lined up, because I thought, well, if I don't get into MGP, I've got a bit of continuity. Yeah. And she was lovely and all sounded good. And we said, why don't we catch up in person when I get back to the sunny coast? Yeah. But by the time then I'd reached out to her again when I was back, she was actually pregnant and she was going too far along.
Oh, my goodness.
I know. And I was like, oh, okay. And then, you know what, I just thought, it'll be fine. It'll be fine. So I just rolled with it. So I was just in basic model of care. And it was a pretty straightforward pregnancy, to be honest. I was just like, loved researching birth, absolutely obsessed, and felt really empowered. And I didn't know throughout the pregnancy, it's like, am I being naive? Like, I really feel like I've got this. I really want a physiological birth. Yeah. Felt really good about it. And like, it ended up being a great birth. So there's nothing particularly notable about the pregnancy. Yeah. Were you also doing your Pilates and whatnot? Like, has that been something you've done for a while, or? Pilates, I always taught on the side. I was working in weddings at the time. I worked for a wedding venue. Yeah. And they were really, because I was actually doing a little bit of admin work while we were traveling, which I was really grateful for them. And then when we came back, I was back in the office, and then I would teach Pilates like of an evening. Yeah. So I worked up until 37 weeks. Yeah. There actually was a little, now it's coming back to me, there was a little moment towards the end where I had some extra scans because my BMI was considered underweight pre-pregnancy. I was completely healthy, but it was just one of those things. So precautionary scans. Yeah, exactly. And some extra scans to check that the baby was growing fine, which, unnecessary. But in my last one at 34 weeks, they noticed that my cervix had started shortening. Okay, yeah. And which can be normal, but I had been having some like cramps here and there, like period pain cramps. And so then there was like this big alarm put on me, like, oh, she might go into preterm labor. Yeah. And that caused quite a bit of anxiety actually at the end. So I did finish up work. I think in the end it was about 36 or almost 37 weeks. Yeah. And isn't it funny how for all that time, I'm just like praying that the baby doesn't come early, like go to full gestation. And then as soon as you hit 37, you're like, okay, you can come now. And I went like right up until 40 weeks,
Oh my goodness. Were there any like particular, aiming for that, I guess, like vaginal physiological birth with Charlie, were there any like resources or anything that you like felt were particularly helpful? Like, did you do any like birth education or stuff like that?
Yeah, I didn't I didn't actually do any, like I didn't do hypnobirthing or anything. We did do the hospital birthing course, which was, you know, it's what you expect. I actually went in with pretty low expectations and I was actually pleasantly surprised, to be honest.
Cool. Yeah.
It was good for my husband just to get a feel for, and I think we already went in knowing that I didn't want, well, I would prefer to avoid a medical intervention wherever possible. So it's not like we're really going in to learn about that. But I did read, what is that book? Oh, I'm having a total mental blank. She's a GP, a New Zealand GP.
Oh, yeah. Sarah Buckley.
Sarah Buckley.
Yeah.
Her book, the name's lost on me as well, but it was such an incredible book, all about the birthing hormones.
Yeah,
That's so insightful.
Yeah.
Loved that. Listened to just lots of podcasts. Like I was binging Australian birth stories and, yeah, just reading up wherever I could. I loved reading. What else did I read? No, lost on me.
That's okay.
But yeah, I went in feeling pretty empowered and pretty knowledgeable. Yeah.
Yeah, yeah. And so you had those sort of cramps with like, you know, maybe cramps at 34-ish weeks, but you got past 37. When did you actually go into labour with Charlie?
I went into labour at 39 plus 6.
Wow.
So, yeah, just before.
Yeah.
Funnily enough, according to the hospital, I was actually 39 and 5, so I never know what to say there. I didn't even realise I was following a different due date. But
yeah, what the heck?
Yeah, but yeah, right up until term.
Yeah.
So, yeah, do you want me to quickly delve into that birth story?
Yeah.
Okay. So, yeah, I'd had lots of period cramps leading up, even from 37 weeks. And I guess with, you know, going into it, I was like, expect to go to 42. But then once I had that rush put on me that I might go into preterm labour, all of a sudden, like 37 weeks became my due date in my head. So I felt really overdue by the time we got to 40. Yeah. So, yeah, lots of cramps leading up. And then I woke up. I was 39 and 6 or 39 and 5, woke up in the middle of the night to pee and didn't notice anything, just went back to bed. Like my theory is to, you know, keep the light off, keep your eyes closed so that you can go back to sleep after you pee.
Yeah.
And then I got back into bed and just noticed I was a little bit uncomfortable, like just couldn't get back to sleep, bit more crampy. So I went back to the toilet and I'd noticed that I'd had my bloody show. And I was so excited, right? The first time, just like, bring it on, like so ready for it.
Yeah.
Rushed into my husband, like, look, you know, so excited. He's like, oh, is everything okay?
Yeah.
It's good. And then at some point after that, I think that was about 3:30 in the morning. At some point after that, I started having some contractions. And I intended to stay at home for as long as possible. Like I'd had the mother's blessing, I had my candles, I had everything ready for this nice long labour at home. But I was bleeding quite a lot. And I thought, based on my research, I feel like this is more blood than normal after a bloody show. So I called the hospital and had a chat to them and just sort of explained as best I could the amount that I was losing. And they were like, it does sound a little bit more than usual. Do you want to just come in to get checked? Yeah. And I was like, I'll come in, we'll get everything checked. And it wasn't like ideal because obviously then adrenaline starts coursing and I'm sort of like, I just want everything to be okay. This is not how I thought it would go.
Yeah.
But anyway, I said to my husband, we're good. Like, let's get in the car. We'll go and get checked. We'll come home. Everything will be fine. I packed my bag just in case. I was like, my husband was like, we won't bother taking bags, right? Because we'll like be coming home. And I'm like, well, I'm just going to pack my bag just in case they make me stay for whatever reason.
Yeah,
he didn't pack his. And so we made a coffee. I got my heat pack. We jumped in the car and it was actually like such a beautiful drive to the hospital. Like the sun was like just starting to creep in and that surreal, feeling of like, oh my God, we're going to meet our baby soon. Like I have such fond memories of that.
Wow.
But definitely expecting to come home. And I think it's about a 25-minute drive to the hospital. Yeah. And my contractions were coming on like a little more intense and I did start having to stop conversation when they would come, and I'd only been in labour for an hour or so at that point. Yeah. And I would pause and I would breathe through it. It was all good. And then we'd go back to chatting. And my mum was meant to be coming. I'd invited my mum to be at the birth, and she lives 5 hours away.
Wow. Yeah.
And I had texted her when I woke up. I said, just FYI, like, there's some signs, but don't stress. Like, once you wake up, maybe like you get your stuff together, make your way, because, you know, first labours go forever. So they say. And all of a sudden my husband was like, hey, your contractions are 3 minutes apart. Like, you do realise that. And
so you're still in the drive? You're still driving?
In the drive there.
Okay.
Yeah, still driving there.
Yeah.
We were almost there. And I was like, oh, true. Okay. Maybe I should call mum. And so we were almost at the hospital and I called, and my dad answered. He's like, hey, T, you okay? I'm like, yeah. We're just going in to get checked, but like, I just think maybe mum should get on the road. He's like, yeah, no worries. She's already out having a shower. She'll hit the road. And I was like, all right, got to go, about to have a contraction. Ended the call. So I was like, right, ditch that thought. Like, she's on her way. It's all good. And yeah, we got in there and they put me in an observation room. This is my least favorite part, like bright lights on, like fair enough. They were just trying to check the source of bleeding, but they left me in there for ages, just like standing around. They put the CTG on, which is, you know, routine. Yeah. But because I was contracting fairly intensely at that point, I had to keep moving, and they kept losing Bub's heart rates, and then they were like delaying how long, because they, you know, have to get a good read.
Trace, yeah.
And it just kept going, and I had like the diarrhea happening by that point. So I'm like on the toilet having contractions. Yeah. They finally got around to having a look, and they confirmed that the bleeding was because I have an ectropion cervix. Do you know what that is?
Oh, no.
It sounds scarier than it is. My understanding of it, my layman's term understanding, is that some of the cells that normally grow on the inside are on the outside, and it can just make you more prone to bleeding.
Oh,
and I did already know about this. Yeah.
Oh, interesting. Okay.
So I guess your cervix is a bit more sensitive.
Yeah.
And I did already know this because I'd had a lot of spotting in between periods in the past, and I also have endometriosis. So I was like, okay, I thought that might have been the reason. So that's good to know that it's all good. I was just bleeding a bit more. Yeah. But then she's like, and also you're 4 to 5 centimeters. I was like, oh, whoa. And I just looked at her. I was like, oh, so I'm not going home? She was like, no. I was like, my mum is 4.5 hours away. Is she going to make it? She was just like, maybe. Like, okay. So that was a big shock. I remember my husband being like, you're joking. Like, what do you mean? You know, it'd been all of 2.5 hours. Yeah. So, yeah, and then it definitely moved quickly from there. Once they put me in my own room, the lights were off. It was like go time. I wasn't talking anymore. I was definitely in it. Yeah. I was very inward. But, yeah, it was pretty straightforward from there, honestly. It was fast moving. I got into the shower for a bit. I felt absolutely no reprieve in the shower because it felt like my hips were breaking apart.
Yes. Yeah.
But I didn't really have any crisis of confidence, which I'm surprised because, you know, fast labours, they're hard and fast. Yes. And it was full on. The only thing I do remember thinking was like, righto, we're not having any more children. This is it. I'll do this, but I won't do it again. Yeah. Yeah. And then I remember at one point being like, I think I want to get in the pool. And my husband said internally, he was like, it's too early. But he didn't want to say that to me. Yeah. But, yeah, the midwife, she's like, okay, but just so you know, it's going to be 20 minutes before you can get in, you know, by filling it. And, oh, my goodness, did those 20 minutes drag. Like, I was just in it in the shower, you know, when it's just consuming you and nothing's helping. Yeah. And I was very, like, I didn't really call on anyone. I was just, like, in my own zone. Yeah. And then I remember when they finally said the pool was full, they laughed afterwards that I basically ran there, you know, like in the throes of labour, and just like ran to the bath and jumped my way in. And that was so much, like that provided so much relief. I was that woman that got in there and just went, oh my God, like I think the weightlessness when it's in your hips. Yes. But yeah, I did have a bit of gas. And then at some point I did start pushing, but, you know, even with hindsight and even with more knowledge now, I honestly don't know whether it was the fetal ejection reflex or whether I was giving a bit of a push because it provided a bit of reprieve. Yes. You know that feeling when you kind of want to be able to do something with your contractions? Yeah. And so I remember the midwife saying, are you pushing? I'm like, don't know, maybe, you know.
Yeah.
And then, that went on for a while. And then they did a check and he was there. They're like, oh, hello, baby. Yeah, he's there.
Wow.
So that was nice to know that we were close. But his heart rate had been reading a bit low, like they were doing intermittent monitoring, and it had been on the lower side. And I was sort of vaguely aware that this was happening in the background, you know. And that all of a sudden they were sort of like, oh, like there was some concern about it. And a team leader came into the room. I don't recall hearing it, but my husband reckons I must have, and said to them, she needs to get out of the pool. And they were like, okay, Tegan, like you've got one more push in here. And I apparently was just like, righto, bring it on, and like actively push with all my might. And I think it recorded it was 14 minutes of like second stage of pushing.
Wow.
I don't know when they counted that from.
Yeah.
But yeah, I pushed with all my might, which obviously, you know, that's not really great, but it did the job. And yeah, soon enough his head was out, which was just
oh my goodness,
the craziest feeling, you know. I was sort of on my back and I remember looking down at his head just like bobbing in the water, and I for some reason in the moment was like, can someone get a photo? And so I had this photo of his head just bobbing in the water.
Oh wow. So the team leaders come in and been like, she's got to get out, and you're like, stuff that. And so like, with that push, like you've managed to push his head out. I
think so. It might have been a couple, but I think because they realised that he was so close, maybe they let me get away with it.
Yeah.
And
well, I mean, what are they going to do? Like drag you out, like you thrashing, like, you know.
Exactly.
They can say whatever they want, but, you know.
Totally. And credit to the midwives that I had. They were actually great. I had a senior and a student, and they just let me do my thing. Like they stayed out of my way. And even like I was vaguely aware of his heart rate being on the lower end, but they kept being like, it's fine. Like I could tell they were very much like, she's got this. Let's just let her have a baby.
Yeah. Wow.
So and then next contraction, he was born, and like just, you know, the most unreal feeling. I was just brought him up to my chest, and it was amazing. But then they sort of were like, I could see they kept sort of checking, trying to get him to do a big cry. He was sort of like a bit gurgly, making a little bit of noise. And I remember sort of looking at them being like, oh, okay, they're a bit concerned. But like I felt like everything was fine and kept chatting to him, and still, you know, just on such a high. And then eventually they're like, all right, let's get you out, see if we can get him a bit more responsive out of the pool and you can birth your placenta. Yeah. And so we got out, and I ended up agreeing to the Syntocin injection for the placenta. I think even prefacing with that prior bleeding in mind, it doesn't really, with hindsight, I'm like, that's not actually a logical reason. But in the moment I was like, yeah, sure.
Yeah.
But yeah, they just weren't happy with his breathing. And in the end they said, look, we're going to have to take him and observe him. So they took him over to the little bed, and they were giving him some oxygen and trying to get him to just breathe it better. Like he was just doing a bit of rapid breathing. Yeah. Or anyway, like the student midwife was like, look, he's going to be fine. She was really reassuring, but I can still remember this moment where the high started to like fizzle, you know, a little bit. I'm like, oh, like I've had this amazing birth, and now my baby's over there. Yeah. I'm sort of sitting here watching. He didn't get to the point that they wanted him to. And then they ended up saying, look, we're going to have to take him to the special care unit. So yeah, that was really sad. I should say my mum missed the birth.
Yeah, I think that was a given.
Yeah. But she actually turned up like not long up, like whilst all this was happening. Cool. And she's walked into the room, and she's like, whose baby is that? And I'm like, that's my baby. But it was that typical thing when your mum arrives, you get a bit emotional. And I think all of a sudden she's like, are you okay? And I'm like, oh, yeah, like I don't know what's going on really. You know, my baby's over there. I think he's okay. So anyway, they took him away. My husband went with him to the special care, and my mum stayed with me. Meanwhile, I had to get some stitches because I had some tears. So that whole thing was pretty like then sobering. You're like sitting there getting stitched up. Your baby's not with you. You're worrying about them. And then I'm saying to the midwife, like, I just want to go and see my baby. And she's like, why don't you have something to eat? Why don't you have a shower? I'm like, I just want to go and see my baby. Like, I just don't really care about those things right now.
Yeah.
In the end, she got a message to say that he'd come good, which was great, and that they would be coming back. So she did convince me to have a shower.
Yeah.
And when they came back in the room, it was like, you know, I remember just bursting into tears, being reunited with my husband and my baby. And I think it was an hour, or maybe not even quite an hour.
Yeah.
And then, look, from there, it was great. We were good. However, in that time, they put CPAP on, and they'd also given him preventative antibiotics because they were concerned there might be an infection causing this, you know, laboured breathing is the term.
Oh, my gosh.
And so then he was on 48 hours antibiotics. And
is that something that, like, consent-wise that they'd, like, discussed with your husband, or?
Yeah.
Yeah, okay. But you hadn't been consulted in that whole thing?
No.
Wow.
And look, no grievances towards my husband. Like,
no.
First time dad,
absolutely
and he was like petrified. He's like, yeah, is my baby going to die? Just do whatever.
Yes.
Do whatever you need to do.
Yeah.
But he literally came good like that, right? Like he wasn't even in any, you know, extreme circumstances. He just had some laboured breathing that they weren't happy with. They took him away. He came good pretty quickly, but they gave him the antibiotics anyway.
Yeah.
And I'm so sick of the word antibiotics because in this pregnancy I've spoken about it so much, but it ended up being like there was repercussions to that, right? Like they give them too freely, and it destroyed Charlie's gut, and we had a really hard journey with sleep and me like having to restrict my diet. Like the postpartum was beautiful, but it was really hard.
Wow. And so like I was thinking when you said that he was gone for that hour, so he was essentially gone from you from that golden hour in terms of like breastfeeding and stuff like that. When did that, like, how does that all match up with him being gone and giving antibiotics? Like what happened there?
Yeah. So whilst he was gone, we did start collecting some colostrum.
Yeah.
To give to him. And so they were planning to go and take it, and so that Cameron could give it to him if he needed it. But thankfully he came back quick enough, and they said, why don't we just put him to your breast? And thankfully breastfeeding kicked off really easily actually. Once he was back with me, I was like, get clothes off me. I want that baby on my chest. Yeah. He latched, he started breastfeeding, and I remember he stayed there for over an hour. Which was great. So I feel like we sort of made up for that time, you know, and I'm really grateful that our breastfeeding journey as far as the actual physical feeding was really smooth from there. So that wasn't disrupted by that separation. And to be honest, I was so grateful to have had a positive birth because those hormones like kept me on a high. Whilst that separation, with hindsight, I realized was a bit traumatic. Yeah. And the repercussions of what they did. But I still reflect so fondly on that experience. Yeah. And, you know, in the moment you're just like, oh, they just did what they needed to do. My baby's good now. It's all good. Like he's fine. So, but it was sort of once we got home, we realised, like I remember thinking like, hang on, like, we actually can't put our baby down. Like as soon as we put him on his back, he's like screaming, is this normal? Like I know that you expect babies not to sleep, but what am I actually meant to do? And like, of course, safe sleep and all of those practices. Like I'd had it in my head that we'd never co-sleep and all these things. Yeah. And he just didn't sleep laying down. Like for the first couple of weeks, we just had to take it in turns. It was mainly me sitting up holding him while he slept. Papa. Yeah. It progressively got a little bit better, but he was always like every 1 to 2 hours waking. And I can remember like he started to get this really bloated belly, and at about like 6 weeks when he had his 6-week checkup and we chose to vaccinate and he had his vaccinations, I remember saying to the GP, like, he's got a really hard bloated belly. I'm like starting to think there might be some intolerances here because I'd done some of my own research with all of his like colicky symptoms. And she was like, oh, look at him. He's stuck it on the weight. He's fine. I was like, okay, fair enough, because he was putting on weight. He was on sort of the other end of the spectrum. Yeah. And then it just like the sleep got worse. And I remember engaging a holistic sleep consultant because I'm like, I'm absolutely not about personally sleep training any extremities, but I just want to know what we can do to help him sleep and help me get some sleep. Yeah. And she came out to our house and she was like, he's got gut issues. Like, we're not going to be able to address sleep until you address his gut.
Wow.
And so, yeah, we just went down this like windmill of, we ended up at a chiropractor. We were seeing all these specialists. My diet reduced down to, at one point I was literally eating, I think, lamb, potatoes, cashew nuts and black coffee.
Wow.
And like a lot of it. Like, it's not like I was depriving myself of food, but we were seeing a pediatric allergist who was, recommending. It was just a really hard journey. And we basically put that down to him being given antibiotics.
Yeah.
Just destroyed his little gut.
Yeah.
That's a big part of his story, and then a big part of the story into Remy's pregnancy and birth. But,
so at what point were you thinking next time I don't want to give birth in a hospital? Or like how was that journey to finding home birth, especially because it wasn't super like on your personal radar before Charlie? When did that sort of come into the picture?
Yeah. So I think because I still see the birth as so positive and I felt so like empowered and proud and capable, I think it just delved me more into the birth world. And obviously the more birth stories I listened to, the more I listened to home birth stories.
Yeah.
And I was like, that sounds pretty cool. Like I could absolutely do that. You know, I think a lot of first-time mums, they just assume that that's not a safe option for them.
Yeah.
But it came on my radar at some point. I can't recall the moment that it did. I think it was just surrounding myself with this world.
Yeah.
And then when I decided to become a doula, I think I was about 6 months postpartum. And I'd been told that my workplace, the wedding venue, they'd actually sold the land to a developer.
Oh.
So I knew a year in advance that they were going to be closing down, which was honestly fine. Like I love them and they've moved on to another business that suits them. And I felt like I was ready for change. So it was like kind of this nice, like, cool, all right, I'm going to start thinking about what I want to do next.
Yeah.
And I thought about midwifery. But in the end I thought, no, why don't I become a doula first? And now that I am a doula, I personally don't feel like the midwife path's for me.
Yeah.
But and then I think once I started my doula training as well, I was like, you know what, I want a home birth next time.
Yeah.
And then I think Charlie was probably about, he would have been like a year and 3 months. And when I attended the home birth as a trainee doula.
Yeah, wow.
And after that, and like it was just, even to this day, I would say it was probably the most straightforward birth I've attended. I've been at one other home birth and I've been at beautiful hospital births as well. Like it predominantly have supported in hospital. Yeah. But just to see how easily it unfolded, like there wasn't excessive monitoring. They're not trying to medicalize everything. Like they're just letting it happen. And of course they're there. Well, I was with the couple for quite a while before the midwife came, and like, you know, the husband and I, we basically just had to sit back and let her do her thing. Yeah. And she just had it, right? And then even once the midwives arrived, like of course they were doing their checks that they needed to do, but they just knew that she had it in the bag. And like, I think being in her own environment just allowed her to relax. And it was just like so incredible, right? And then her just having a baby and then getting tucked up in her bed, and we brought her food, and she was just like, she got help to have her shower and then back in her bed. It's like, this is unreal. Like this is the way it should be, or at least this is a beautiful way for it to unfold, and not many people realize this is an option. Yeah. So or that it's possible, not just an option, but like birth can actually be like that. Exactly. And she was a first-time mum, like full credit to her. She did hypnobirthing. She got a doula. She got a private midwife. Like she's a beautiful women's health physio. So she's like in the sphere of helping women. So I think that helps. And I think I'd already had it in my head. And then after seeing that, I was like, that'll be me next time. Like that's what I want. And I'd said to my husband, I want a home birth. Why don't we should start putting away money for a private midwife. So when the time comes, it doesn't feel like such an outlay. Yeah. We weren't so good at actually making that happen. He was like, yeah, sounds great. And then we didn't. But that was sort of how I came to the decision of wanting to have a home birth. Yeah, cool. Do you want me to sort of move on? Yeah, so Remy is 6 months. So does that mean that was the Univer the Sunshine Coast home birth program happening when you were pregnant with Remy, or was that a bit late? No, so a month before we conceived, they announced the program. Yeah. that it was coming
Yeah, okay,
so
sure.
I think they said it's coming June or July.
Yeah.
And Remy was born in August. So
Yeah.
that sort of changed my trajectory. I remember when I heard that, I think I was at a birth screening. There was a birth film on. I can't remember which one it was. And there was like a panel discussion afterwards, and they brought up that it was coming.
Yeah.
And when
was it the Born at Home doco?
No, it wasn't Born at Home. I did see Born at Home, but I think it was like about based in water. Was it Pacific Mother?
Oh, Pacific Mother. Yeah. Where they go to the different islands and stuff, and the Japanese and like Maori. Yes. Yeah. Okay, cool. Yeah.
I'm pretty sure. Yeah, I was there with a fellow doula friend, and they started talking about it at the end, and I knew that we were going to try for a second soon, and I was sort of like, okay.
Yeah.
And my brain was like, oh my goodness, I could get my home birth without having to pay. This is enticing.
Yeah.
And so, I sort of started getting really excited about that and told my husband. And of course, like, I logically was like, don't expect this program to be perfect. A, you've got to get into it. B, it's not the same as private midwife. And I knew that, but I still was like, this is exciting.
Yeah.
And I was thinking, like, why wouldn't they accept me? As much as what happened with Charlie afterwards, in their eyes, my birth was really straightforward. My first birth. I'm like, my first birth was pretty straightforward as far as the, actual birthing, labouring and birthing. And, I'm going to apply straight away. Like, I can't really see why they wouldn't accept me. I'm a second-time mum, I felt like I ticked all the boxes.
Yeah.
And so, we conceived the next month or, whenever it was. And no joke, I peed on a stick one day. I booked into my doctor the next day, and I was like, I want you to refer me to this home birth program. She didn't even know it was a thing.
Yeah.
But I was like, knowing last time, I didn't get into MGP because I kept getting knocked back. I was like, I want to apply now. She's like, yep, cool, let's do it. So she referred me. But it was a pretty long journey before I heard anything from there. But the first trimester was a bit of a journey, and sort of has a big role in how it ended.
Yeah. Okay.
So you're happy for me to sort of
go for it.
Yep.
Yeah.
Got referred, all was good. And then I ended up with some thrush symptoms. I think I was about maybe 7 or 8 weeks. And interestingly, I think I actually got thrush after attending a really long birth at hospital. Like I was there as a doula, and you're already at higher risk of thrush when you're pregnant due to the hormones. And then I was just there for it was quite a long labor. I think I was there for over 24 hours.
Wow.
And wearing synthetic fabrics, which is a big no-no, like lycra pants, and didn't shower in that time, like just not ideal.
Yeah.
Not ideal, and ended up waking up with thrush. And I think after a few days it was Christmas time, so I was busy, but in the end I thought I should go to the chemist and get something for this. And they said, go to your GP and get checked that it's not BV or thrush. Yeah. BV versus thrush, because obviously the treatment protocols are different. So I was like, okay, booked into my GP. She said, let's do a swab to check whether it's thrush or BV. Yeah. And while I was there, I also said, just so you know, I've had a little bit of spotting the last few days, but I'm not really concerned because I had spotting with Charlie and it was all good, and I have this ectropion cervix which is prone to spotting. And she was sort of like, okay, do you maybe just want to get your HCG checked again to check that it's still going up? Yeah. And I was like, yeah, okay, like that's not particularly invasive, it doesn't impact the baby, like why not? So got the swab done, and then I went and got my bloods done, and then was just awaiting her call. And I think it was 2 days later she called, and when I answered, I could tell straight away that like she was like, how are you? And I was like, I'm good. I feel really sick. Like I had really bad nausea in both my pregnancies. I feel really sick, but like otherwise good. And she's like, okay, so like any more bleeding? And I was like, oh no, actually not really, any more spotting. She was like, okay, like why, what's wrong? She's like, your HCG has actually dropped. And like this is before the point where your HCG is meant to level out. Like it was just before. It probably would have been around 9 weeks then, 9.5 weeks. And of course, like your heart just sinks. I'm like, wow, like, am I having a miscarriage right now? You know, spotting plus HCG dropping. But in the same breath, I was like, I feel so sick. Like that day was probably the day that I felt the sickest. It was the only time I ever had to cancel a Pilates class because I was teaching Pilates as my main job by then.
Yeah.
And I'm like, it just doesn't make sense, you know, in my head. So, but then also I was like, okay, and what about the swab? And she's like, yep, so you do have thrush. You've also come back as GBS positive.
Yeah.
And I was like, okay. But I guess the priority of that phone call was that I was potentially having a miscarriage. So that was sort of, she was like, you just need to take a course of antibiotics for the GBS and it'll all be good. And I was like, okay. And, you know, being a doula, I knew a bit about GBS, but, you know, my doula trainer always says, like, it's not your job to know about every medical condition. That's not your role.
Yeah.
And I sort of knew it was in my head. I was like, okay, red flag, GBS, but let's deal with that later. And so I went and I got in for an urgent scan that day because I thought, yeah, she said I would recommend you go and get a scan and see what's happening. I thought, yeah, I'd rather know what's happening in case there's like a miscarriage.
Yeah.
And thankfully Bob was fine. It was
How
really bizarre.
bizarre.
Yeah, all good. It was obviously just that my HCG was leveling a bit earlier than we had expected.
Yeah,
you know, I think it's
interesting.
normally about 10 to 12 weeks it starts to level.
Yeah. Were you pretty confident that you were like 9 weeks or whatever like they thought you were?
Yeah, I was, based on like conception dates and our dating scans and that. Like I felt like it was pretty on the mark.
Yeah.
And it did, and well, who's to say, right? I had to, But yeah, so thankfully it was such a relief. Like driving to that ultrasound was such a bizarre feeling.
Of course.
One part of me is like, I feel so sick, surely everything's fine. But the other part of you is like, well. But yeah, so thankfully went away from that scan, all was good, but then my mind switched to GBS and I was doing some more research and trying to understand, hang on, because she presented it to me that I had a GBS infection and that I needed to have antibiotics. And I'm like researching, I'm like, hang on, am I GBS positive or do I have a GBS infection because I don't feel ill? Like I was very confused.
Yeah.
But I thought, and like I really wanted to, obviously with Charlie's story, I really wanted to avoid antibiotics in this pregnancy and particularly in the labour and post. But I'm thinking in my head, well, if it's going to get rid of this infection now and this isn't going to be a red flag for the rest of the pregnancy and labour, I'd rather deal with it now and work on my gut health and everything through pregnancy. And so I had a call with her again 2 days later and she's like, I'm so sorry. Obviously everything was fine with the scan. Let's talk about GBS. And I said, so sorry, can I just confirm, am I GBS positive, given that I'm just positive to have this bacteria present in my body, which, you know, 1 out of 3 women have, or do I have an infection? She said, oh, no, you have an infection. I'm like, right, okay, no worries. So I took the antibiotics and naturally my thrush didn't go away. It got worse with the antibiotics.
Yeah.
And I went back like a week or so later and had to see a different doctor because my doctor was away.
Yeah.
And she did another swab because I'm like, something like I just don't feel right down there. Like, should we do another swab and see what's going on? She's like, yeah, you still got thrush and you're still GBS positive. So you just need to take another course of antibiotics at some point. And I'm like, but I just taken a course of antibiotics and it hasn't worked. It's just flared up all my issues. Like, she's like, oh, well, you just have antibiotics in labor. Like, it's all good. Just leave it. And I think it was after that I was like, right, I'm going to approach this from a different lens. Like the medical route isn't working for this. They're just jumping in antibiotics. It's not working. I don't want to, flare anything up even more. So I actually ended up having a consult with a prenatal nutritionist.
Okay, cool.
Who's very holistically minded. And I chatted to her, A, about the thrush because I had recurring thrush at this point.
Yeah.
And B, about the GBS. And she was like, we can, she was very much of the mind that we can absolutely resolve the thrush and the GBS overgrowth with diet. Cool. Your gut health is absolutely impaired at this point.
Yeah.
Which I know after having antibiotics.
Yeah.
Yeah, we can absolutely resolve this. You could go and get retested for GBS and probably be negative. We know that obviously it's a transient bacteria, but anyway, so I just decided I did that. I did the diet changes. I felt really good. The thrush was gone like almost immediately. And then from there, I just decided to leave it because I thought GBS in Queensland, it's not even something that's routinely tested for. Like they don't routinely test for it. So there would be any number of women birthing with GBS without. So I just left it. But I kept following up. Am I in this home birth program? Like I'm not hearing anything.
Yeah.
I think
so by this time, you're like around 12-ish weeks or?
Yeah. So when I think I was 14 weeks when I had the nutrition consult.
Yeah. Okay. Yeah.
And so, getting into my second trimester, like Bob was tracking fine.
Yeah.
All was good. My nausea was a burden, but it was like very slowly starting to ease.
Yeah. But then you've been waiting for like a month at this point really for the home birth program to sort of give you some sort of response.
Oh, yeah. Like I think I applied at 5 weeks. So,
yeah. Oh, my gosh.
But I remember by 15 weeks, I'm like, come on, surely they wouldn't have even had many candidates. Why wouldn't they just be like, why wouldn't they be saying yes to me?
Yeah.
Yeah. And of course, because otherwise I wanted to explore private midwives.
Yeah. And like really get that like ticks, but exactly.
Exactly.
Yeah, oh my gosh.
And I'm like, look, if I'm not in, I just want to know, so that I can start saving for a private midwife and go down that route because I was really adamant that I was having a home birth. And then, I think it was at about 15 or 16 weeks, I followed up again and they were like, oh, it actually looks like you're outside of the catchment, the 30-minute catchment. And I was like gobsmacked because I didn't even consider that I was too far away from the hospital.
Yeah.
And they go by, the ambulance maps and, it's 25 to 30 minutes, I will say. It's 25 to 30 minutes trip to the hospital pending traffic. So maybe they were more generous with their allowance for time putting me over 30 minutes. But I was pretty devastated. So,
and that it took them so long to get back to you because of that.
Exactly.
That's so annoying.
Exactly.
That's
so annoying. I just kept following up, like, just let me know. I just want an answer.
Oh.
So that was out of the question at that point.
Yeah.
And so that, and I started exploring private. But obviously, like, we all know that private midwives, it's costly. Granted, they're so worth it. Like, it's worth every penny. But they are an expense. And so, I chatted to a couple of private midwives and I picked one that I really loved and gelled with, and we paid for a prenatal consult with her. And I felt really good about it. Like I was like, I want this home birth. She seems amazing. And she was like, I discussed the GBS with her and she's like, everything is your choice. I wouldn't even be testing for that anyway. That's not going to change anything for me.
Yeah.
She was very of the mind that it's one of those things that you can't control.
Yeah.
Regardless. But then leading up to, I think it was about 21 weeks, you pay a big deposit to secure the continuity of care, which again is of course valid. Leading up to it though, for some reason, I kept like questioning, is this the right decision? And I felt like once we got past that barrier, of course, you pay that big deposit and it's non-refundable, which of course is also fair enough. For some reason, I just kept feeling like, oh, why does this not feel like suddenly the right choice? It was nothing to do with the midwife. And in that time, I got a call from the hospital and it was my favorite midwife that I'd worked alongside to date as a doula, calling to say, hey, just letting you know that I've got a spot in MGP with me as your primary midwife. Like, would you like to take it up? And I was like, why did I get this call right now? Hospital birth has never seemed like an option for me. But suddenly I'm questioning this private route and I get a call from, like, she was the midwife I was hoping to get if I got into the home birth program, Suddenly get a call from you offering me a spot in your care. And it tormented me. When I tell you it tormented me, I was like, what am I doing? Like which avenue am I choosing here? And in the end, I just decided I actually just need breathing room. Like I can't lock into private midwifery right now. I can't lock into that route. For some reason, there's something blocking me. So I just said that to the beautiful midwife. I'm like, I'm so sorry, but like both for financial reasons and just, it just doesn't feel right. Can we just delay it? Of course, I know that you'll likely book someone else. Like you've got to do what you've got to do. Yeah. But there's a block here, so I'm going to leave it and I'm going to take up this MGP option while it's available. Yeah. And went on that route. And it was in my head. I was like, it is what it is. And I actually said to my husband, because he was very much like, just go the hospital route. It's free. You've got a great midwife. You'll be fine. You'll just have the baby. Like, it's all good. we don't need to spend, suddenly he's like, we don't need to spend $6,500, you know? And I was like, well, you know what? I just want you to be prepared that I might have this baby at home.
Yeah.
Because anecdotally, second labours are quicker. My first labour was all of 6 hours.
Yeah.
And secondly, if I get to transition quickly, I know the absolute last thing I'm going to want to do is get in the car and go to the hospital. I just know that my instincts are going to be like, no.
Yeah.
So just be prepared that if we go this route, there's every chance that I'll have this baby at home with nobody here. And
yeah.
he's like, okay. You know, like not, you know, he's like, well, can you not? Like, can we make it to the hospital? But
yeah.
You know, so that was sort of already in my head. But yeah, we kept tracking along. The pregnancy was like tracking fine. Bub was going great. You're so busy the second time with, you know, when you've got another bub into like running around.
Especially like a little bub as well, like a littler bub at that point as well. Yeah. Yeah,
very consuming. I was still breastfeeding up until about, I think I stopped breastfeeding when I was about 9 weeks.
Wow.
But yeah, and then in that time I was still attending births as a doula.
Yeah.
One of my clients was in MGP and she had a lovely midwife, and I got chatting to her just about the home because she could see I was pregnant. And she's like, what are you doing? You know, what's your route? I said, I actually applied for the home birth program, but I got knocked out. And she was like, is your surname Shepherd? And I was like, yeah. Like, yeah, I've seen your file. I'm actually in charge of the home birth program. I'm really sorry about the fact that, you know, the radius thing, blah, blah, blah. And nothing else came of it. We just had a chat. And she was like, great. I was really impressed with her care.
Yeah.
And then 2 weeks later, I get this random call from her to say, hey, we have extended the catchment area and I'd love to offer you a spot in my care.
What?
In the home birth program. And I was like, what? Like, it was like the greatest day of my life.
What?
You know, that's how it felt crazy. In that moment.
Yeah.
I was like, oh my gosh, everything happens for a reason. This is why I didn't sign up to the private care. You know, This is why I had all that torment.
Yeah.
And it felt great. So, yeah, I was in it. It just was awesome. We kept tracking. I had a couple of appointments with her, and, like, she was honest in her appointments, just being like, you know, this is a trial program. So just be aware that, you know, there are reasons you may not end up having a home birth. And, of course, you're like, it's a bit defeating to hear, but you're like, yeah, I get it. You know, it's a publicly funded
They have to say what
program.
they've got to say, I guess.
Exactly. Yeah. But, you know, he is hoping it doesn't get to that. And the GBS hadn't been brought up at that point because I figured it's on my records. If they want to find it, they can find it. Yeah. They don't even routinely test for it, so they wouldn't know most people's status. Yeah. Anyway, so we kept tracking along, and then at 33 weeks, I got a call from her to say, I'm so sorry, but the doctors have been scouring over all of the candidates and they found that you tested positive for GBS in your first trimester.
Oh, my God.
Removing you from the program.
No!
I was just like, oh, my God, like, you're kidding. I was so bummed. And she was like, yeah, look, I'm like, can I have a meeting with someone to contest this? And she was like, look, you can. I can set you up a meeting with the head OB, but, like, your chances of changing their mind are pretty low. Like, they're pretty cautious. But I was like, no, just set me the meeting. Like, I'm not a particularly confrontational person, but I'm like, no, I know my rights, especially working as a doula. Like, I see the way they just take control, and I don't want that for myself. I want to give myself the best shot. And I did all my research. Like, I'd read GBS Explained by Dr. Sarah Wickham, and I felt like I was doing everything I could to keep my body as healthy as possible. And I should say, like, I'm not negating, like, the very awful implications that can happen with GBS. There's babies that have died and babies that have become unwell, and that's devastating for those families. But, you know, statistics are on our side. Like, the chances of anything happening are so low. So without delving into it too much, I just went into this meeting, and my main thing that I was going to say was, if my choice or, you know, my right to be in this program is going to be based on a GBS result, let it be a current one, not one from 6 months ago. You know, like, how is that even relevant? And in this process, I also had found out that it was actually in my urine as well as in my vagina, which I'd never been told previously, which is what is more of a concern. Okay. Currently. But anyway, I went into this meeting and I said, look, I get that this can be considered really serious and you're very much on the side of caution here, but this is my choice. I'm doing everything that I can. I'll do everything that I can to minimize the risk to my baby. Can we at least retest? Let's retest and see where I'm at and then rediscuss. But the OB was great. Like, he was like, you know what, if you're comfortable birthing, I'm comfortable with you birthing at home, because the main thing is they can't offer antibiotics at home. I said, I don't want antibiotics in labour anyway, which is what they usually do if someone's GBS positive. I don't want antibiotics unless there's other risk factors and my baby is at risk, then sure, I'll consider that. But I don't want that as a standard route of care, and I really want to birth at home. And he was like, yep, look, you're really confident. You and I both know the chances, the risk to your baby is really low. There's lots of risks, there's lots of other risks in labour that we're not accounting for here in general. So you're confident, so I'm confident with you birthing at home. And he gave me the tick of approval to be back in this program.
Oh my God.
I was like, whoa. And he didn't even want me to retest, because he's like, look, it's a transient bacteria, which is the thing, right? Like, you can test positive one day and test negative the next day. So it's not even, a GBS swab isn't even really a reliable source to prove how at risk your baby is. Like, any number of women are birthing that are potentially GBS positive at the time, but they just wouldn't know. And, so that was like, I was just like, whoa, I did not expect that outcome. So thrilled, back in the program, but my guard was very much up. I was like, God, they've really medicalized this so much already. This pregnancy has not been particularly enjoyable in this sense. Like, I haven't been getting this nice, exciting lead up. It's just been like so wishy-washy.
Yeah.
But we were back on.
That's so amazing, Tegan. Oh my gosh, that you advocated for yourself like that, and then it like actually paid off. That's right? Like, so amazing to hear.
I thought I was wasting my breath, and I should say, like, to preface the meeting, I went in and I sat in the waiting room for over an hour with no one tending to me, because they had not actually booked in the meeting properly. And like, I remember like going up to the counter and I was like, what is my meeting happening? Like, what's going on? By this point, like, I'm just a bit nervous and over it. And they're like, oh my gosh, it wasn't booked in. He didn't even know it was happening. So going into this meeting, I'm like, this man doesn't even know who I am. Yeah. Probably. Why I'm coming. Like, this is not going to go my way. And anyway, it went in my favor.
Wow. Oh my gosh. But also, like, this whole thing up until this point, like, listening to like your intuition and like, this doesn't feel right, and like, I'm going to do this, and that's, holy moly, go you. That's so cool.
Yeah. Yeah.
Wow.
So yes, I was back in, and I was so thrilled. But I should say I don't take like, I guess the difference between me and a lot of other women is I was aware that I was GBS positive at one point in my pregnancy, whereas a lot of women just don't even know their status in Queensland. So I didn't take that knowledge lightly. I was doing what I can with my diet to minimize bacteria overgrowth in my body. And I was very aware that like water birth can minimize your risk of passing anything on to your baby, and also risk factors like preterm labor or prolonged rupture of membranes can put your baby at slightly higher risk of contracting an infection, which is what everyone's afraid of. So I wasn't taking all that lightly. It consumed up a lot of headspace in that last month or so. As much as I was back in the program, I'm like, right, I need to do what I can to keep myself healthy, keep my babe healthy, and fingers crossed they don't kick me out again for whatever reason.
Yeah. Oh my gosh.
We just kept tracking. And like, this is a very new program. No births had happened yesterday. I was going to be one of the first.
Wow.
So even every time I met with my midwife, I could just, even though she was great, the meetings just like, it was just always talking about like the risk of being kicked off, blah, blah, blah.
Ugh.
And so it was a bit defeating, like it was really messing with my positive energy. And it was exhausting. And anyway, we got to just before 37 weeks and they dropped everything off, dropped the birth pool off, all of the equipment. And I was like, we have made it. Like, let's do this.
Yeah.
We set the birth pool up, like just blew it up, test run.
Did you have any of that like random bleeding
no.
at this point? No. Cool.
No, I didn't have any extra scans. I didn't want any extra scans in this pregnancy. So I'd had lots of period cramp pains in the last trimester.
Yeah.
But I didn't read into it this time, I was like, it's just my body preparing them. I know so much more now. I'm like, great, my body's doing what it needs to do to slowly prepare for this labor.
Yeah.
Your cervix is priming. And so I welcomed those little niggles and that. But I didn't have any concerns about, preterm labor or anything.
Yeah.
And yeah, really excited, had set up all my birth affirmations in my room, all of that jazz. And then I was, I think I was 37 and 3 or 37 and 4. And I got a call from my midwife again. And like, when she answered the phone, I could just tell where this conversation was going. She's like, Tegan, I'm so sorry. but they've just reviewed everything again and they've decided to remove you from the program again, and there won't be any changing that again. And I was just
oh my God.
I swore, like, not obviously directed at my midwife because she's just the messenger, right?
Yeah.
But I was just like, can I swear?
Yes.
I was like, you have got to be fucking kidding me. Like, what do you mean? I'm literally full term. I could have already had this baby by now, and you're going to remove me from the program on the same premise that we've already been through.
But they've already dropped the stuff off.
Exactly. I'm like, maybe I should just have this baby tonight. Like, what do you mean?
What?
And on top of that, like, it's all about this GBS result, right? And they told me that their main concern was that it was in my urine, but I'd had it checked, and what was in my urine was just contamination from my vagina. This is like very TMI details. But,
no, please, yeah.
And I'd actually been in at the hospital, sort of a detail that didn't need to be mentioned, but I was in at the hospital a couple of days prior only because I become really unwell with like some sort of virus from my son. Yeah. And we were a little bit concerned that I might have had a kidney infection. Just some of the symptoms were a bit funny. Yeah. So I went in to get checked and they did a urine sample. Yeah. And I was like, this is going to be interesting if they find anything in this urine sample. Like if they find GBS, they might kick me off. Anyway, no GBS on my urine sample that day. Not that they were looking for it, but it would have come up anyway. Yeah. So they're kicking me off this program 4 days later based on a test result from when I was 6 weeks pregnant, but my test result from 4 days prior, it didn't seem to negate that. Like it didn't matter. It was just like, they were like, no, just policy. This is just purely policy. Like they had some more training with a Melbourne crew that are very medically,
Oh my God.
And I was like, and I got off the phone and I had to end the call. I'm like, I'm sorry, I've got to go. And I just burst into tears. Like I was just gutted. I'm like, what is all of this for? Like what? I was just beside myself, and my poor little son's like on my lap going, you okay, mummy? Because I'm just like crying. And I've called my husband, like, I've been kicked off, you need to come home. Like he was already on his way home from work. Yeah. And yeah, I was just beside myself. I'm like, what the actual fuck? And he walked in the room and I was like, fuck this. I'm just going to have this baby at home anyway. And he like looked at me. He's like, I thought you'd say that. And I was like, wait, like you're not shying away from that. He's like, well, if you want to, you can, I trust you. And I was just like, what? What do you mean? Like being in the doula world, of course I know about free births, and I'm all for women choosing whatever they want to choose. I trust birth. I trust the women to make the right choice, but I wasn't really in the free birth sphere, and it did not feel like the right choice for me prior to that. Like I hadn't really considered that. Oh, no, sorry. I had considered, I remember when I was giving Cameron all the options earlier in pregnancy, I was like, well, if you don't want to pay for a private midwife, the other option is free birth. And he was like, hell no. Yeah. But all of a sudden he was like, I think he'd just seen me go through this whole journey and realized how much they can fuck with your head and mess up.
It's so unethical. This is so unethical.
So unethical, right? My pregnancy was so unnecessarily stressful. Yeah. And so wishy-washy and so up and down. And to mess with a woman's emotions at that point in pregnancy, I just thought I already didn't want to birth in hospital. And now even more so, it is the last place I want to go. I don't trust you. I don't trust that you're here for me. This decision was not for me or my baby. This decision is because you're just trying to cover your ass with policy. Yeah. This is not the safest route for me.
No. Yeah, because oh my gosh. I mean, we could go on and on and on, but I just have never, ever understood. So what, they kick you off the program this late in pregnancy. So really your only choices, quote unquote, are to free birth or to go to the hospital, which you don't want to do. So no wonder women end up being forced to choose to free birth because you've just said, okay, well, it's all or nothing, and there's no middle, there's no individualization, it's not woman-centered care at all.
Exactly right.
At all.
Exactly. And on top of that, with the MGP program, even if you're just in MGP, the continuity of care program, the midwives can come out to your home to do early labour checks. Yeah. And so sometimes that eventuates into like an unexpected home birth, right? Like if it's progressing quickly and they realize they can't get to hospital. But my midwife said to me, I've also just been told flat out I can't tend to you at home. So not only can you not have a home birth, I can't even come out to you because, and I said, well, what if like we know, and she'd even said this to the board, like this woman had a really fast first labour. We're speaking anecdotally, it's likely her second labour will be even quicker. It's very likely that she'll, baby will be born before arrival. So I said, what happens if my labour progresses quickly and I'm at home? She's like, yeah, I can't come out to you. We'll just have to call an ambulance. And I'm like, that is like actually absurd. Yeah. That's a big factor in why I wanted a home birth as well, is like I anticipated that this would likely eventuate quickly. And I knew that the last thing I'd want to do is get in a car and drive to the hospital and transition, because I was very lucky to sort of skip that the first time because we went into hospital earlier than planned. I didn't really have to deal with that.
Yeah.
So my husband and I, like, I was never completely like steadfast in like, yeah, right, we're having this baby at home now. I was like, I'll follow my intuition. If something doesn't feel right, of course I'll transfer into hospital. But if you feel confident that if I feel like this is the right choice and this baby wants to be born at home and I feel good in myself for this baby to be born at home, as long as you feel good in that, then let's do it, Because I guess that's the thing is you do ideally want the partner to be supportive. You don't want their fear coming into the space. Totally. And he was like, I trust you. I've seen you birth. Like, you've got this. You know so much. He's like, just let me go and watch some YouTube videos that you've been recently. Yeah. I don't know what videos he watched. But I was like, wow. Like, I was like blown away that he was so on board. But I like respect him so much for that.
Yeah.
So then from there it was not ideal making that decision at 37 weeks. I have to say, like, that's something that when families choose free birth, they usually choose that quite early. Yeah. And so they spend people think that that's an uneducated choice, but if anything, those couples educate themselves more than anyone.
100%. Yes.
Up to birth.
Yeah.
And so, I went down like the route of just like, okay, what more do I need to know? What could happen? I listened to a lot of free birth stories in those few weeks, and there was a couple of great episodes on the Free Birth Society podcast just about like newborn's first breath and just things to look out for and instinctive safety things that to know that like as a mother and a mammal, like you'll likely do in response to any warning signs, which sort of helped me really trust that, I've got everything I need for my baby. And if not, if I feel like something's wrong, then I'll call for help. Yeah. So, it was a wild few weeks. We kept it pretty close to our chest. I said, I don't really want to tell anyone this is our decision. I don't want anyone's fear. It's already big enough for us to process. I don't want anyone else's fear creeping in if they know that we're planning for an unassisted birth now. Yeah. And did you have to like return the pool and everything? Like, yeah. How depressing. Yeah, they can. It was so like, and it was a bit awkward after that, like my meetings with my midwife, because I couldn't tell her, planning. And I also wasn't like, I was, like I'd said, I was very much like, if I feel like I want to transfer to the hospital and that feels safer in the room, I'll do it. Sure. That's fine. At least I know I do have a great midwife on my side. And the whole pregnancy, she was like, you've got this. You're going to like just pop this baby out. She was very supportive of physiology and my, believed in me. But it was a bit like I could see she sort of trying to inadvertently ask me like, what is your plan? Like, you are going to, like, you're going to come into hospital and like, it was so awkward. I felt like we were dancing around actually saying what we wanted to say. Oh, yeah. But everything got picked up. And that was depressing. I was like, don't want your birth pool anyway. And then, get it, rid of it. I said, get it out of my sight. I didn't care. And but then the lead up to birth, like I felt pretty good about it. And then so we'd also, I should say, I'd engaged a fellow doula, had just started doing videography and photography. Oh, amazing. Just separate to her doula work. Yeah. And I thought, in the pregnancy prior to all of this, I decided that, well, actually I'd love to have it on video, but I just wanted it to be the right person. I thought, she's lovely. She's a doula. She already knows how to be in the birth space without being interfering. So I engaged her and she attends free birth. So I did tell her like the change of plan. I said, look, just so you know, this could be a free birth now. Yeah. And she was like, yeah, great, go for it. So she was probably the only person we really had to keep in the loop about what was happening. So, yeah, leading up to, I guess I can probably go into how birth started from here. It's not to say I didn't feel like nervous feelings or fear at times. Like I wasn't really fearful, but it was like, how is this going to eventuate? But I just kept telling myself it'll all unfold how it's meant to. This has all happened for a reason. My baby, like I really felt guided by my baby. And for the first time in my life, I felt so intuitive. I was like, this baby is telling me that they want to be born at home. I'm just trusting this process. I trust myself. I trust that I'll know if something's wrong. And it was like a constant mantra for 3 weeks. And I remember I got to 39 and 6 and I was like, there's no baby yet. Like, this is so weird. You expect to have your second baby earlier than your first, And I was like, no baby. And then I woke up on my due date, still no baby. And I felt really good in the morning. Like I was like, growing my body, like I always say to my doula clients, like you should be so proud of your body for growing a baby to full term, right? Like what an incredible thing. We all demonize this dreaded due date if we meet it, but how good. Started the day feeling really good, booked a massage, went and had a massage. But I think because it was my due date and maybe some people knew, I think family must have known, I all of a sudden had people like checking in on me like, oh, how you going? Still pregnant? That sort of jazz.
Yeah.
And I started getting really irritated. I was in the afternoon, I was like, oh my God, like I don't want to talk to anyone. Just leave me alone. I went for this like walk in the afternoon. I said to my husband, I just got to get out of the house. I'm going to take the dog for a walk. The dog was annoying me. She kept wanting to stop and sniff things.
Yeah.
The neighbor wanted to chat. And I'm such a friendly person normally, but I was like, oh my God, I just don't want to chat. I don't want you to ask how far along I am. I was so grumpy. And going to bed that night, I was like, maybe it's the start of labor. Like I'm pretty on edge, I'm pretty hormonal.
Yeah.
And I was meant to be meeting up with one of my best friends the next day. And I was like, you're at that point of pregnancy. You're like, I'll let you know in the morning if I'm still pregnant and then we'll go ahead with our plans. Anyway, woke up. No, nothing was new. I was like, okay, still pregnant. So I'm 40 plus 1 at this point. I messaged her and said, we're all good for today. And I should mention my son got gastro 2 days before.
No.
And then my husband caught gastro and I was like petrified of getting it. I'm like, I cannot get gastro right now. I cannot go into labor with gastro.
Oh my gosh,
and
can you imagine?
All these things. Oh, like truly, no. Unfortunately, it did happen to my best friend a month later.
Anyway, my goodness.
I'd somehow avoided it. Like I said, you guys are sleeping in the spare room. Stay away from me.
Yes.
And, but I was so worried about them and still tending to them. And that morning, I'd woken up, text my friend. I was a bit crampy, but it was nothing out of the ordinary. And my husband walked in with my son and was like, I think we're good finally. Like, we're clear. And I was like, oh, thank God. Yeah. And then it was like all of a sudden I was like, just so you know, I am pretty crampy this morning. And it's like my cramps just all of a sudden picked up.
Wow.
Interesting. Like no, contractions coming and going, just like period cramps a bit more intense than they had been. And I went to the toilet and lost my mucus plug, or some of my mucus plug popped out. And I was like, whoa, okay, this is cool, like super excited. But I was like, oh, you know what? The sun's coming up though, and it's very abnormal. As we know, melatonin increases oxytocin, so normally labor kicks off at night. Yeah. So I said to my husband, look, this is really exciting, but it could just peter out. And I was almost like half expecting it to peter out because it was just period cramps at that point. Yeah. And also we know that mucus plug is not a given that you're about to go into labor. So there was no blood this time as well, which was different. You expect you to follow the same trajectory as your last birth, but there was no bloody show. It was just a bit of mucus plug. But then I got back in bed and I did start having like contractions. I was like, ooh, definitely having contractions. But they were pretty spaced. Oh, I didn't time them, Yeah. But it started to get pretty exciting. And my husband was like, so should I call my mum and tell her? Because she was going to take our son. We decided we didn't want him there, particularly given that it was just going to be us. I wanted Cameron's focus on me. Yeah. And I was like, oh, no, not yet. Like it might, like this was about 6 a.m. I was like, no, because it might not eventuate. Like let's just give it a bit more time to know that it's actually happening. And then he went to the toilet. And my son was on me and he was like trying to get my attention and try and play with me at one point. I was having this like which was obviously a contraction, and I couldn't concentrate on him, and I was just like, oh my God, I need to just stop talking for a moment. And I text my husband, even though he was literally in the next room on the toilet, but I was like, I think you need to call your mum and just let her know. Because all of a sudden my head was like, no, this is eventuate, like this is moving.
Yeah.
But I think I was still in denial for about the first hour. And anyway, he called his mum and she was like, yeah, no worries, I've got a haircut at 9. Should I come and pick him up at about 10? Cameron was like, do you think that's like going to be okay? And I'm like, yeah, like it should be fine, I guess.
Yeah.
And then all of a sudden those contractions they were rolling, like it was game on. And
wow.
I was like, I'm definitely in labour. You know, I don't know how, we weren't really timing, but I said, you're going to have to call your mum back and tell her to come earlier.
Yeah.
And so I think that was about 7. She was like, oh, okay, I'll come and get him. And I'd let Lana know, who was coming to do the photography. I said, just so you know, like I think I'm in early labour. And I felt really good, I should say. No fear was coming up. I was like, yep, we're good. Like, felt confident. My mother-in-law came at 7:30. I had to keep like going away to go and have a contraction and come out and have a chat, you know, said goodbye to my son. And like, that's such an emotional thing. I'm sure you know as well. Like, when you're just like, oh my gosh, this is the last time you're going to be my only baby.
Yes.
So yeah, so beautiful. And he was quite clingy, but he loves his grandma. So it was really beautiful for him to just be excited to go off. I said, see you later. And then it was like, from then we were on, you know, the contractions were so hard and fast. I had a birth sling, loved that. My husband was so good. He just like, once my son was gone, he just like turned all the lights off, closed the curtains, put the fairy lights on, put some calm music on, set up the birth sling.
Wow.
Must
have been some good videos that he'd watched. You'll have to ask him what he watched.
I know. I think me also, like, you know, always talking about birth. He's like, I didn't even have to tell him a thing, you know, he just did it. It was so good.
Yeah.
But boy, was that labour intense. Like, it just kicked off and they were just like on top of each other. It was so consuming. And my mantra to myself was just like, let it consume me. Like, just let it happen. I was standing most of the time. I was swaying with the help of the birth sling and in a real squatting position. But it was still, you know, hard to tell, like, where are we at here? And I still hadn't had a bloody show, which in my head I was overthinking it. I'm like, why haven't I had a bloody show yet? But bloody shows can be a great sign of cervical dilation, you know. And because my labour had kicked off with that in the beginning, I'm like, am I not even in active labour? Like, is this still early labour, you know? Yeah. This is insane. Like, this is so intense. And so just overthinking it. And I'd even told Lana, like, oh, maybe don't come yet. Like, I don't know. I don't really know. I don't want anyone in my space too early. Like, I just really wanted her in the background capturing.
Yeah.
But yeah, then I got to a point where I was like, nah, come after school drop. Like, she's like, I'll be there about 8:30.
Yeah.
8:45. I was like, yep, sounds good. And yeah, it just took over. Like, I was roaring. I remember, like, at one point closing the toilet windows to try and block sound from my neighbors, because this is like mid-morning, right? Yeah. Absolutely roaring the house down. I'm not a quiet laborer. Yeah. Just letting it go. Like, there was no calm breathing. I was calm in a sense in that I was just letting it happen, you know, very primal. And I was standing up roaring at one point in a mid contraction, and my waters broke all over the floor. Yeah. Which was a really cool sensation for me, because my waters broke in the water last time in the bath just before birth. So I didn't really get to experience that. Yeah. But I remember just like stopping mid contraction, like, whoa, okay. Yeah. And then Cameron's like, what's wrong? I'm like, my waters are broken. Can you fill the bath? Like, I need to get to the bath. And it was at that moment that Lana arrived, and she walked in. She's like, whoa, like, she did not expect to turn up to me, like. Yeah. And I was like, I think the baby's coming. She's like, oh, yeah, okay. I'm like, yeah, okay. So I've run to the bath in between contractions. They were truly back to back. Like, I just remember wishing I could have a break. Yeah. Got in the bath while it was still running. And bless Lana, at one point when I got into the bath, she's like, all right, why don't you just try taking some slow, calm breaths and keeping your voice like low, like, you know, just with the best of intentions. She didn't realize how far along I was. And I looked at her and I was like, oh, like, you know, my voice is like my biggest outlet at the moment. She didn't realize I was probably too far gone for that. Trying. It was good in that little bit of reprieve. I probably had the biggest space between a contraction in that moment, kneeling in the bath, and I did take some slow breaths. But once that contraction came, I was back to just like roaring.
Yeah.
And I felt him we didn't know the gender. I felt babe so low. And I don't think I realised how close I was, but I'm like, I can feel hair.
Wow.
And then all of a sudden I felt that big stretch, like I'd just gotten in the bath. Big stretch happening, and I was doing like the panting to try and slow Bub's head coming out because I really wanted to avoid tearing this time if I could. So I did a lot of active pushing with Charlie.
Yeah.
So I had some tears. Panting to slow it down, and then next thing the head was out, and I was like, the head's out. Like the bath was like it really wasn't full enough. But Bub, I said to Cameron in the moment, you need to make sure Bub's head stays under the water.
Yes.
Because I'm on all fours.
Yeah.
He was on that. He was like, yep, no worries. Lana had like managed to get her camera set up to capture the final minute. And next contraction, I pushed again, fetal ejection. I was just meaning that Bub came out. But I thought Bub was all the way out. So I've gone to turn over and Cameron's like, no, babe's still inside you. He'd just been birthed to about his hips. Yeah. And so I still had to push the legs out. But then, I pushed again. I gave it, an active push then to get Bub out, and then flipped over, and Cameron, had caught him and brought him up to my chest.
Whoa.
And he was here. It was just like a crazy,
what the heck?
3 hours.
Oh my
3 hours
goodness.
from that first moment. It was like just insane. Best moment of my life. So cool. He didn't come out crying. Yeah. And, I was just chatting, like looking at him in awe, being like, hey, baby, And then I realized his cord was around his neck. So I quickly unraveled that. And that, like, in the moment, that really didn't feel like a big deal, Yeah. I just was like, yeah, cool. I'll unravel that. But he really was quiet. He was a bit gurgly, and he wasn't crying. Yeah. And he was a bit like, a bit purpley, a bit blue. And I was like, okay, it would be good to stimulate him a bit more. So I was just doing my own stimulation, just talking to him, rubbing his back a little bit, kissing him all over his face, blowing in his face a little bit. Just thought I'd love to just get that bit more reassurance from him that he's good. Like I could see that he was good. He was looking around, but just not that solid reassurance. Yeah. And Cameron was sort of like, is he all right? I'm like, I think so. And, we didn't expect to call on Lana in any capacity beyond, obviously she's a doula, but, she's not going to provide any medical advice. And I said to her at one point, like, what do you think? She was like, she wasn't really here or there about it. Yeah. I said, maybe we'll call Sarah. That's my midwife. Like, I felt enough trust with her that I could call her in that moment. Yeah. And I said, why don't we call her and check? But we got this other midwife, Sarah's phone had been diverted. And I think she was just confused. She was a bit like rude, and I think she was just confused about what was happening. She was sort of like, well, what's happened? You've had this baby at home. Is baby not breathing? And Cameron was trying to explain what was happening. And whilst this conversation was happening, I'm looking at my baby and I'm like, he's fine. Like, I actually feel like he is fine. Yeah. And this conversation is just ruining my bubble. Like, I just, in the end I said, look, I actually think he's fine. She was great. She was just trying to help. Yeah. Said, I think he's fine. I'm just going to end this call. I don't want to call an ambulance or anything. I think he's good. And we got off that call, and he all of a sudden just latched to my boob and started feeding. Wow. And then it was the most perfect latch, and just fed. And it was like him just being like, I'm good. Wow. I just had a quiet emergence, I'm fine. And Sarah, the midwife, did end up calling back. She'd gotten out of a Pilates class, and she's like, so thrilled for me. She was great. She was like, you're amazing. She's like, if baby's feeding, he is completely fine. Yeah. And it was just the most beautiful reassurance from my baby to just be like, I'm good. And it was a shame that we had to make that call, but no regrets. Like, that's me being on guard. And I guess that's the thing when you are choosing to birth unassisted, you're kind of taking on that responsibility. Totally. You can't just be in complete glory when they come out. You've got to actually look at your baby and be like, how are they? Are they responsive? Yeah, that's totally on me right now. Yeah. Solely on me. Yeah. And after that, it was really magic. I could just soak in like, holy shit, like I just had my baby just in my bathtub. Yeah, wow. Like, it was just so cool. And I ended up getting out of the bath probably after half an hour and moved to our bed to birth the placenta. Yeah. I didn't rush it. I was starting to get contractions, but I didn't really want to push too much. But in the end, I was kind of sick of it being in there. So I got on the bed and got on all fours and gave a bit more of a push. And it plopped out. It was so funny. My husband was trying to get the bowl below me in time and he didn't make it. And then I'm like, well, you're just going to have to grab it and put it in the bowl.
Yeah.
Bare hands picks up my placenta like, oh my
chunky
God.
piece of meat.
Yeah. But he was so down for anything. Bless him. He was so good.
Wow.
And then like just that feeling, like you would know it. You just get to be in your home, in your bed with your new baby. Just like, wow. Like the ultimate high.
Yes.
Ultimate high. It was unreal. And it was nice to have Lana there then, because she just like went and made me a bowl of food while Cameron was with me, and helped me get into my shower. And like, that shower, I handed, after a while, I should say, we cut the cord. We left it ages and we had a cord tie. Cameron cut it, on his own. It's so funny. That's the one thing people always ask about when we say we birthed at home unassisted. They're like, what about the placenta and the cord? Well, we just sterilized some scissors and cut it.
Yeah.
Like it's like this great thing.
Yeah.
And he had his skin to skin and I went and had a shower, and we've got a beautiful outlook over our yard from our shower, and just standing in there like, what the hell just happened? Like it's a Tuesday morning. I'm standing in my shower having this beautiful warm shower.
Yeah.
I've just birthed my baby. Like it was just so euphoric and best day of our life. It was just the best.
What a wild journey. Holy moly. Like, I feel like, I think I won't be alone when people listen to this. I feel like I went on like a roller coaster, and I mean, that's just hearing about it. You actually went on the roller coaster of like, you're in, you're out, you're in, you're out. Yes, no, maybe. Oh my gosh. And then, for it to all like, boil down to, what did you say? 3 hours.
3 hours.
3 hours. Like that's what the argument was over, about 3 hours basically.
Yeah, exactly. And it was the most simple, natural thing, like all that stress. And of course I understand it to a degree, but anyway, the whole journey, like as far as everything happens for a reason, like everything happened for a reason. It was such a tumultuous journey, but I don't regret it in the sense that it led to the most perfect birth. Like I think that was actually how it was meant to pan out, and I would not have known that at the start of pregnancy. If someone told me you were going to have a free birth, I wouldn't have, or an unassisted birth is how I choose to phrase it. I wouldn't have believed them, or but everything happened to get us to the point where we were ready to take that step and take it into our own hands. So it was pretty incredible.
What a beautiful, beautiful journey and story, and so beneficial, I think, for people to hear about the whole GBS schmozzle. And you mentioned a really awesome resource by Dr. Sarah Wickham that I'll make sure I link so people understand that. Because I had 2 home births here in Victoria, I feel like I didn't really have so much pressure about their GBS, but I think in Victoria it is routinely swabbed. I think it's like broad, everyone gets it unless you decline. So important, if you're listening, to check maybe if you're not really sure what the process is, just so you're aware. But and I know on the is it the Great Birth Rebellion or the Midwives Cauldron, there's also a GBS episode that's quite handy.
Great episode. I listened to that multiple times.
Really
good episode. That and GBS Explain were really helpful.
Is there anything that we haven't talked about that you feel like you want to talk about, or you want people to know that are listening, or anything like that?
No, I don't think so. I guess with these publicly funded home birth programs, I think they're a really incredible initiative, and I think it is really great that they're making home birth accessible. But I guess I definitely say now to anyone, if you really want a home birth, if that's really important to you and you want a midwife present, go the private route, like spend the money. And that's easier said than done, right? Because it's a big outlay, and that was a big factor for us.
Totally.
But there's no guarantees with the publicly funded home birth program. They're in control. Just remember that they're in control. And there's a lot of beautiful stories that come out of it. And I hope to support some as a doula, But I guess just if it's really important to you, spend the money on a private midwife, I would say.
Yeah. Well, thank you so much for taking the time on your Sunday morning to share this brilliant story of the birth of Charlie and Remy. I'm really grateful. Thank you.
Thank you. And thank you for the podcast. I love listening to it. So it's pretty cool to be on it now.
Thank you so much, Tegan.
See ya.